Are you getting ready to explant and you are really worried about what it's going to feel like and how much pain you're going to experience after your explant surgery? In this video, I'm going to talk about the 4 common things that happen that can cause the most pain after your explant surgery and 7 things that you can do about it to either help manage it or completely make it go away. Welcome back to another video, and if you are new to my channel, hello, I am Christina, the founder of Size Happy and the admin of the best Facebook group on Facebook, Breast Implant Illness, Rejuvenation, and Education with Christina, and you can also find me on Instagram at I am Size Happy. So come to find out, pain is actually one of the 4 things that women are really worried about after their explant surgery. The other 3 things are how they're going to look, of course. Are they even going to make it through the actual explant surgery? Because a lot of us are actually so sick and so weak, we don't feel really good. And so we're really concerned about having to go through a surgery when we're not really at our healthiest. And then the 4th thing would be just the recovery. What's that gonna look like? You know, what can I expect from the explant? And of course, everybody is so different. We all respond so differently to everything, but I do wanna let you know I have some good news. So I took a poll inside of my Facebook group and I asked my members, like, what was their explant surgery like in regards to pain. And so I'm gonna look over here because I have the notes. So a lot of women said, the vast majority of women said that it was a little bit painful, but the pain pills were able to manage the pain. The second group, which was very close to the first group, was that they barely felt anything at all after their explant surgery, but that was because they got the nerve block. And then there was a very small group of women, 13 out of the 100 votes, so 13% of the women said that it was very, very painful. I do find that most of the women say that their explant surgery wasn't technically painful. It was more like they did 100 push-ups and they just felt very sore. Things felt very tight and they were very tender. So the 4 things that I have found contribute to women having more pain are the drains. If you've had any kind of muscle repair during your surgery, that can also contribute to a lot of pain. If you've had any scraping, like if they've had to scrape any capsule off of your ribs or, you know, up in your armpit area or anything like that, if one breast had a little bit more scraping than the other, that can also contribute to a lot of pain. And then even the binder, the compression bra that you're going to go home in, that can cause a little bit of pain and irritation too. I know that it did for me. I'm very bony in between here, and I had these little clasps in here when I was wearing the bra. And so this was always digging into my chest area. And then the compression bra kept like creeping up and it would irritate my incision area. Out of everything, I feel like those 4 things typically are what can make an explant surgery a little bit more painful. If you have a low pain tolerance or if you are just really concerned about the pain after your explant, something that you can do starting the week before your explant is to get on arnica. So arnica is really good for bruising and swelling, but it can help to reduce a little bit of pain. If you want to go a step further, I would definitely recommend looking into nerve block. So when you go to your explant surgery consultation, ask your explant surgeon if they offer nerve block, because this will help to minimize pain for up to 3 days right after your explant surgery. And then of course, be on top of your pain pills. Some women take the actual prescription pain pills, but a lot of women do find that all they really need is extra strength Tylenol. I know for me, I only took extra strength Tylenol for 3 days, but I did get the nerve block. And just those 2 things really helped to manage my pain. And for me, the explant did feel like I was just more sore than being in a lot of pain. And your surgeon will probably tell you this, but right after your explant surgery, anywhere from 4 to 6 weeks after your explant surgery, you do want to keep your arms down and have those T-Rex arms. You don't want to do any kind of lifting up overhead. You don't want to, reach down and pull anything up. You don't want to put your arms out, anything like that. Your arm should really be by your side for 4 to 6 weeks after your explant, and that can help reduce any kind of pain and swelling. Number 5 kind of goes with that one, is to not lift much. So again, for the first 4 weeks easily, I would say really don't do too much with your arms. I mean, definitely don't clean. I wouldn't really recommend like playing too much with your kids, anything like that that requires your arms or your chest. I would definitely stay away from that. The 6th thing is to sleep on an incline. For me, I slept on an incline for 5 weeks after my surgery, and I do feel like it really helped to manage my pain and manage my swelling and to help things kind of heal and fall a little bit better after my explant. And lastly, if your surgeon does say that you can do this, because mine didn't, but I have seen other women do this, is putting some ice packs up on the top of your chest. So definitely not on your actual breast tissue, but you could put it up here, and that can reduce some swelling and some pain after your explant surgery. If at any time you have like massive swelling, a lot of blood in your drains, shortness of breath, anything's like hot to the touch, and you just feel like, I don't know if this is normal, you definitely want to reach out to your explant surgeon. I know how easy it is to just go inside of a Facebook group and ask a question like, hey, does this look normal? Or I'm in this amount of pain, is this normal? Which it's good to run those things by us, but I always recommend that if anything just doesn't look or feel normal to you, definitely run those things by your explant surgeon first. So I hope that this video was helpful. Get on that arnica, be on top of your pain pills, see if you can get some nerve block, use ice, don't move your arms too much, don't move around too much, and try to sleep on an incline, because I have found that all of those things really help with pain and swelling after explant surgery. So I will see you on the next video. Be sure you're subscribed too. Bye.